Hello, I'm Marcia Molinaro. I'm a physiotherapist. I work in National Cancer Institute of Brazil in a palliative care unit. I coordinate a group of physiotherapy and oncology in Order of Physiotherapy in Brazil, and I am director of Brazilian Association of Physiotherapy in Oncology. I had participated and presented a little of my work in 5 congresses about palliative care. The last congress were the European Congress in Portugal and the International Congress of Palliative Care in Montreal, Canada. And I have visited some institutions in Montreal and in Paris. I had already did a research about complementary therapies, especially reflexology, in National Cancer Institute of Brazil. Now I am moving to Montreal, Canada to work with physiotherapy. But maybe I will not work in palliative care, not because I don't like, but because unfortunately in Montreal the physiotherapists they don't work in a palliative care unit. Not because it's not important, but because there is no sufficient people that work in physiotherapy. There is not a lot of physiotherapists in Montreal. That's the reason. But I intend to do a master in fatigue and show the importance of the quality of life that physiotherapy can do in palliative care. Well, I would like to share a little bit of my work with you and a little bit of what I learned in the congress that I participated. First, the indicators. The indicators are very important for all professionals in palliative care and to show the importance of our work and new paths that we have to take. We should use more indicators to evaluate our job, to evaluate what we are doing, and to qualify our work. So I think that it's good to read more and to learn more about indicators. The second one is fatigue. Fatigue has a high prevalence, but it's not clear in the literature. There are lacks in the studies. We know by the articles published that the exercises are important. But what kind of exercises? For what kind of patients? How long has the exercise to be prescribed? We don't know. There are few uh, works about it, but it's not clear. So I think that we need good studies about protocols and we need more research about fatigue and exercise, but more clear. The studies has to be more clear. The third one, well, we really have to understand that pain is more than a physical symptom and try to understand the total pain. And maybe, who knows, use more simple techniques as massage to improve the treatment. So we have to study more about it and understand more about it. We can use a lot of complementary therapies to improve our work too. Massage, reflexology, acupuncture, tai chi chuan, qigong, yoga. The last two international congresses that I participated in Canada, they showed the importance of complementary therapies in palliative care. And the Jean Garnier Center in Paris, they use complementary therapy too. So we can study more about it and use some techniques to improve our job. We have to improve our communication too in palliative care. It's an important tool. We have to improve our communication with other physiotherapists, even those that do not work in palliative care directly, with our team of health professionals, with patients, families, and volunteers. Communication is an important tool in palliative care, but even with a lot of work published, it's a great problem to develop in palliative care. So, actually, in many health systems, not only in palliative care, because I can say about my experience in oncology, palliative care must begin in the moment of the cancer diagnostic. And at this moment, the communication has to be very, very clear. Another thing is we should be more persistent and publish and do more literature revisions and researches. I think that if we want to show our job, what we are doing, we have to publish. And we have to study more about palliative care and about our techniques. Another thing is we have to continue our studies after university, after many years working. Continuing education is very necessary. Innovate and search new things, new tools are important, and encourage our students too. The research must begin in the university, and we have to encourage our students to write and send posters to Congress. We have a beautiful work to show and an important work to do. We promote quality of life and independence to our patients. We definitely need to work in an interdisciplinary and integrated team. We have we have to work like that. And another thing is the fatigue. I talked a little bit about fatigue, but I forgot to tell that we have to use in fatigue to evaluate our exercises the KPS and something to show, to demonstrate the fatigue of the patients. So we can use the scale from 1 to 10 or from 0 to 10 to evaluate this fatigue of the patients and use KPS. The works about fatigue and the thoughts about the exercise, they don't do this. So it's a great lack, as I said before. Sorry. And well, I wish a good Congress to everybody. And if someone wants to contact me or to know a little bit about my work of fatigue, you can send me an email, marciamolinaro@gmail.com. Okay? Thank you very much.